Okay, I would now like to introduce one of our community members and Myeloma Australia ambassadors, Marlo McCarthy. Marlo is a beautiful mum of two young men. She's an interior designer by trade and has a very unique and inspiring story of the lived experience with myeloma. Marlo has been instrumental in raising awareness of myeloma throughout the community and has recently become a member of the inaugural Myeloma Community Advisory Board. It's my absolute pleasure to invite Marlo to share her story with us today. Thanks, Marlo.
Thanks, Kat. Thanks so much for having me, and hello to everybody that's watching this. I'm thrilled to be here and spend a little bit of time telling you a bit about my story. My journey with myeloma began in 2014 when my husband Tony Walsh was diagnosed with myeloma. He was 43 years of age, and he'd had a virus that he just couldn't shake, and was subsequently diagnosed from there. At the time, our boys were 6 and 7. Tony went on back then. The treatment options were really a stem cell transplant or a stem cell transplant. So Tony went through the process, had his first stem cell transplant, achieved full remission, and then a month after that, he relapsed. It turns out that Tony had an extremely aggressive form of the disease. And I do really want to emphasize that he was really at the top end of the spectrum in terms of aggressive disease. His story is certainly not what most myeloma patients experience, but he relapsed. It was like a firestorm. Came back, he was incredibly sick, incredibly quickly, and really everything that could have gone wrong for Tony did. He had a go at the first daratumumab trial, and he did have a response to that, but he was unfortunately too sick to meet the criteria of the trial, so he couldn't stay on that. So then the next plan was for him to have another stem cell transplant and then a donor bone marrow transplant. And we were really fortunate that his only brother was a match. So we had all of that set up, but unfortunately Tony wasn't able to achieve remission with that second stem cell transplant, so the bone marrow transplant couldn't go ahead. He actually died 17 months after his diagnosis in November 2015. He was 44 and our boys were just turned 9 and were 7. So that was our introduction to myeloma. Prior to Tony's diagnosis, we'd never heard of it. I often speak to newly diagnosed members of the myeloma community, and I'm just struck by how many people still don't know about myeloma, and that's something that really tugs at my heart, and it is what's motivating me to get involved and be part of advocating for awareness. But subsequently, I then obviously got on with the not little task of being a sole parent and raising two beautiful boys on my own, and carving out my career, and wellness and health and fitness was a really big part of that for me. I really wanted the boys to see me very fit and very healthy and very well. I needed to feel that way to do everything that was required of me as a single parent and a working mum. And obviously, the grief in losing Tony was profound, but we are very well supported by a beautiful community, and I have to say that life, has been pretty good to us in the subsequent years. Everybody got around us, and the boys have had, quite an amazing childhood, all things considered. And Tony continues to be a part of our daily life. We continue to talk about him every day, and he continues to parent the boys. But then when I was turning 50 and I was feeling particularly tired and, thought maybe I'd hit, menopause, and maybe I was iron deficient, and took myself off to a GP just across the road from work, and said to her, I need you to do my bloods. Can you just check out what's going on here? So she rang me and said, yep, you're low in iron. But for some reason, just intuitively, I felt like there was more going on. So I went back to her and said, can you just send me my blood work? I just want to have a look through it. And I looked through it and I saw all the same markers of disease that I'd seen with Tony's blood work. And I went back to her and said, I'm in trouble here. I need to see a hematologist. And, I think I've got myeloma. And, her response was to say to me, no, 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 that's an old person's disease. So then I took myself off to another GP who I see sort of for the bigger stuff, and went into her and said, look, I think I need to see a hematologist. And she was like, you're absolutely right, you do. And from there I was diagnosed. So I made the choice to go back to the hematologist that had treated Tony. It was a bit of a double-edged sword. I knew that I was walking right back into the environment that, we'd both experienced quite a lot of trauma in that space, but I also knew that I was going to get exceptional care. The hematologist would have a vested interest in my case, and everybody in that caring group would be determined that it was not going to go the same way as it did for Tony. So, and another big thing for me was accessibility to the hospital. So it made a lot of sense to go back to where Tony was treated, which is the Alfred Hospital in Melbourne. So straight away, they started me on the standard line of treatment for a stem cell transplant. I had 2 lines of treatment, and then stopped for a month and had my cells harvested, commenced the 3rd line of treatment, and my disease progressed. So that meant that I have primary refractory myeloma, which is not a good diagnosis. And from there, we knew that we were dealing with something potentially as aggressive as what Tony had experienced. I have to say, right from the outset, I've been blown away by how far treatment has come in the 10 years since Tony started, 9 or 10 years since Tony started treatment to when I started treatment. It's quite extraordinary what progress has been made, and it's incredibly exciting and certainly very reassuring in my case. So I started on an immunotherapy trial of iberdomide, isatuximab, and dexamethasone, and had a really good response to that. That was incredibly exciting. I was able to go from progressing on my first line of treatment to being the first person on the trial to achieve complete remission. They then wanted to do a bone marrow aspiration, and their expectation, the medical professional's expectation, was that there would be some residual disease lurking, as that's what myeloma does. But they couldn't find any trace of disease. So that then sort of propelled me to stringent complete remission, which is kind of the utopia of remissions. And again, that was just incredibly exciting considering where we'd come from to get that result. And at that point, I wanted to have a very honest conversation with my hematologist, and I had him alone for a moment, and I just said to him, am I going to be here in 10 years' time? And he said to me, only if we do a bone marrow transplant. And I said, okay, let's go for it. And I need to be very clear that my treatment choices, and they have been my choices, I've been very fortunate to have a say in what goes on, but have been really shaped by my personal experience. And I think seeing Tony miss out on that opportunity for a bone marrow transplant, I just didn't want to miss out on. I wanted to take the opportunities that he missed, and have my boys me do everything I possibly can to stay. So, and it was sort of the time when my disease, it was to come back because as effective as the trial was, it was going to come back at some point, and being of such an aggressive nature, it was going to be a lot harder to treat. So whilst I was in such a great point in remission, I just said, let's go for it, and let's go for it now. So I opted to come off the trial, and then I went to have a stem cell transplant. I had 7 days in hospital, recovered from that, and 8 weeks later, I had a donor bone marrow transplant. My sister was a match, which is pretty amazing. There's 25% chance of a sibling being, a match. And I'm on day 42, 100 days of isolation. It's certainly no small process to go through. I'm sort of at home twiddling my thumbs quite a bit at the moment because there's not a whole lot that I can do. There's a bit of an internal war being waged with the bone marrow, trying to make friends with this foreign body that it's in. And then, of course, externally, I have no immunizations or vaccinations, or so I'm at significant risk of infection, when I sort of go out into the big wide world. But I think so that's sort of the summary. It's quite involved. That's what's gone on for me. But really, what I think has been incredibly positive, because there have been so many challenging moments, and I've had to work very hard at separating off, my disease from Tony's disease and his experience, is right from the outset. And we certainly did this with Tony's illness as well. Was my focus was to develop relationships with those people caring for me. I'm very fortunate that my hematologist has a nurse practitioner that operates, on his behalf every day, and she's always at the end of the phone. But I would, actively, every time I would go in for treatment, actively really engage with the nursing staff, really try and find out about them and their lives and develop those relationships wherever possible. And it's certainly made my experience of going into the hospital a lot more positive. I had people sort of to catch up with, people that I was interested in, relationships, banter, conversations and company. And I like to think it was also a really nice experience for those nurses as well, and those people that were responsible for my treatment. When I went on to the ward for my stem cell transplant, I was blown away to when, over the course of my stay, 5 different nurses came into my room to care for me. And those same nurses had cared for Tony, who spent probably about 10 months on the ward in his 17 months of fighting the disease. And to reconnect with them was absolutely beautiful. I was well able to remember precise moments of beautiful care that they showed Tony. They remembered him, and they took, exceptional care of me on the ward. So there's been some real nuggets of positivity through this whole experience. But I think, one of the, if I had to sort of highlight anything, I think for me personally on the trial, dexamethasone was incredibly difficult to deal with. And I think there is still, my parents are certainly this way with their healthcare, but there can still be a real mentality around being a good patient. And I really, really struggled with the effects of dexamethasone, which so many myeloma patients do. And I kept quiet about it, and I kept quiet about it, and I kept quiet about it. And eventually I said to my hematologist, I don't think I can keep doing this. And his response was, let's just reduce the dose by half. Like then and there, just in that moment, and I'd been holding on and holding on and holding on and thinking that I shouldn't really complain about this. This is just, what I need to do. And from there, subsequently, I was weaned off dexamethasone. And also certainly being on a trial, I think what we need to remember is that these medical professionals are actively learning from us in real time. These are drug trials. These, are experiments. We need to be a voice. We need to speak up about the impacts of these drugs, of side effects, of how we're feeling, of the issues that we're facing. And because, whilst they have data from studies on things like, progression-free survival and that sort of thing, they actually, what it's like to live with these treatments in real time, that comes from us. So I think it's incredibly important that we, have a voice and feel comfortable in feeding back. And because, it's such a complicated disease to treat. I think the focus can often be so much on what the actual disease is doing. And if we can feed back, we're going to have, better outcomes for all patients and more information to pass on to allied healthcare workers. And I think there's a lot we can, self-advocacy, is just so incredibly important. And another something else that I had along the way, which was really positive, was IVIG. That really helped. I know a lot of myeloma patients have that, as an additional treatment to help boost, our immune systems. And I think that was a real turning point for me as well in feeling more well and certainly develop less infections, less viruses, and that was a really, that was an opportunity that I'm incredibly grateful for having. So I think that's sort of, I know we're running a bit over time, so I know I'm speaking quite quickly, but I think overall what I'd like to say is just what a positive experience my treatment has been, and how excited I am, even considering the nature of my personal disease, about what's going on in the space. There's so much work to be done, but actually at the time of my diagnosis, I had 6 fractures from my right shoulder down to my right hip, and my spine is riddled with lesions, but I remain pain-free and very mobile, and looking forward to getting past this 100 days and getting on with a bit more.
So much for sharing such a unique experience, and I think you really demonstrated the individual care that we need to provide to myeloma patients, particularly when you look at your journey in comparison to your husband's journey as well, and also how crucial clinical trials and research is in developing our treatment and helping people to live better and longer with myeloma as well. So thank you so much for sharing.